1 more minute to go.
Okay. Okay.
Okay, start. Yeah, very good afternoon to all. Once again, we have actually today a bit special because we do invite nurses to this talk, and we have gotten more than 100 registrations from the nurses all over Klang Valley. I think the furthest also I saw few from Kuching as well, right? Then without much ado, for nurses, we are going to share with you the QR code later on during the Q&A session or after the Q&A sessions. So therefore, that QR code is for you to actually drop your detail as the attendance, and in order for us to actually send you the e-certificate after the event lah. So we will try to send it to you within this week, and therefore you can actually claim your CNE points. This is actually 1 point. Yeah, right. Before we begin, let me introduce our speakers today. He is Dr. Irshath Ibrahim Ali, graduated with Doctor of Medicine from University Science Malaysia and further obtained his postgraduate medical diploma in the UK. He further obtained an advanced master in dermatology from University Kebangsaan Malaysia, and he also obtained diploma in aesthetics medicine recently. He is currently practicing as consultant dermatologist in the dermatology department in Sultanah Bahia Hospital Alostar, and also he is a visiting dermatologist at KMI Taman Desa Medical Center since last year, November. He is also a member of Dermatology Society Malaysia, and he was a former honorary lecturer for AIMS University Malaysia, as well as College University Isania, Sungai Petani. Okay, without much further await, Doctor, the floor is yours.
All right. Thank you very much, Ms. Louis, for that kind introduction. So good afternoon, everyone. I will be your speaker for today, and the topic that I am going to present is on eczema. Eczema is also known as the itch that rashes. So why is it called that? What is eczema in the first place? It's an inflammation of the skin, whereby your skin becomes, you'll exhibit symptoms like itch, and then when you start scratching, you'll develop a rash, and then it's often associated with dryness. And when you itch, you'll scratch, and therefore the rashes tend to develop. That's why it's known as the itch that rashes. So this is sometimes termed as the itch scratch cycle. So you can see in this picture over here, you have an itch. So it's you just can't help yourself. You just need to scratch, and once you start scratching, you will compromise, or your skin barrier won't be so good anymore because you have scratched it, and then this will allow anything from the outside environment, like irritants, allergens, or even infection, to penetrate your skin, and this will result in inflammation, and inflammation is what leads to eczema. So itch, and you scratch, you develop a rash. And if infants can't scratch, so you can even rub. It's either rubbing or scratching that will develop the rashes. So what are the common triggers of eczema? Aeroallergens top the list. So aeroallergens means things that you inhale. So you might not necessarily see what it is that you're inhaling. So on top of the list is pollen and house dust mites. So pollen can come from a variety of flora. That means like tree pollen, grass pollen, weed pollen, rye pollen, and also flowers that smell very nice. Fragrance flowers like lilies and daisies are also aeroallergens, things that you can inhale and can trigger your eczema, or if you already have eczema, it can cause worsening of eczema. And then besides that, if you have household pets like cats or dogs or rabbits, the dander, which is the skin that the animals shed, if you were to inhale it, can also trigger your eczema. Rats, rodent, urine, saliva from rodents, debris left by cockroaches, and in your house, if there's mold buildup in your walls or in the bathroom, so the molds they're a form of fungus, so it releases fungal spores. So you can inhale that. That can also trigger your eczema. So there are a lot of things, physical irritants like wool, synthetic fabric, polyester, spandex, environmental factors, food, infection, and pregnancy can also either trigger your eczema, or it can cause existing eczema to become worse. So the simplest pathogenesis, or why eczema actually occurs, is something known as the outside in or inside out theory. Simply put, outside in theory means your skin is already not so good. The barrier protection for your skin is not so good. So anything from outside can easily penetrate your skin. Why your skin? You might be born with this, because 20% of patients or infants that are born, they have some genetic mutation, so it affects the skin barrier. So your skin barrier is already compromised. So if you were to scratch, then you allow anything from the outside environment, like allergens, infection, like bacterial infection, viral infection, can easily penetrate your skin. Now, the inside out theory means that the inflammation starts from within, inside your body, and then it causes your skin barrier to become not so good. It becomes compromised. And then the same process repeats. Once your skin barrier is compromised, it's easy for anything to irritate your skin. Now, that's the easy version of understanding eczema. Today's topic is meant for the public and also some healthcare staff. So I will not bore you with very complicated and complex pathogenesis like this. Basically, if you're studying dermatology like myself, we need to know in depth the pathogenesis of eczema and up to the molecular level. So luckily for all of us, I do not need to explain this today. Is eczema contagious? No, it's not contagious. You can't catch it like a flu from someone else. Sometimes I have parents who come to the clinic and their child has eczema, and the school might request for a letter to verify or to clarify whether eczema is contagious or not. So the answer is no, eczema is not contagious. So besides eczema, eczema is part of this term called atopic march. So if you were to look at this graph, atopic dermatitis is eczema. So the light blue chart here, the graph here. So eczema usually starts first, and then what can happen is that the child who has eczema can also develop food allergy before the age of 2, and then they can also develop asthma just before the age of 5. As they grow older, as they are approaching 5 years old, there's a higher risk of developing asthma. And then the other one is allergic rhinitis. So this is called an atopic march, whereby all these diseases are somewhat linked, and it occurs by sequence. So the first is atopic eczema or atopic dermatitis. Second is food allergies. Third is asthma. And the fourth one is allergic rhinitis, and sometimes allergic conjunctivitis as well, where you have runny nose and watery eyes. So what are the types of eczema? Eczema can present in a variety of fashion. So The commonest one that we see is called atopic eczema or atopic dermatitis. So usually children, they present with dry skin, scaling, redness, and then when they start scratching, they develop excoriations, and then they can go on to develop infection. So this is the typical distribution. In younger children, like in infants, they tend to affect the head and neck area, like here over the cheeks, as the child, and also the outer part of the limbs. But as the child grows older, it starts to affect other areas like the skin folds. This is the skin fold of your elbow and the skin fold of your knees. And as it gets worse, it can affect your entire body. And when you start scratching, your skin tends to become thicker, like what has happened here. This hydrotic eczema, or this otherwise called another name for it is Pompolix eczema, is an eczema where you start developing blisters. Blisters are small bubbles that can appear on your skin. Like this second picture here, you can see they are small blisters. The medical term would be blisters or vesicle. So it looks like basically it looks like bubbles, and inside it there's fluid. And this is a clearer picture of this hydrotic eczema. So it can develop usually in your fingertips or your fingers or your palms, or even on your legs and your soles. Discoid eczema looks like a coin. Discoid means round, and it looks like a coin. So this type of eczema can develop on your limbs, either on your hands, on your legs, or even on your body. So this type of eczema, it tends to be a bit wet. And wet means weepy. So it can be associated with erosion. Erosion means that once you scratch the skin and the skin layer has come out, it looks erosive like this, and also weepy. It has this wet look. And then the other one is stasis eczema. Stasis eczema usually affects older individuals, patients who are above 50 or 60 years old. They might have other underlying problems like high blood pressure. So what happens is that they develop eczema changes over their legs. So you can see it's very dry, and then there's some redness. So they'll tend to scratch, and once they start scratching, the skin becomes thick, like what has happened here. The skin has become thick. And this is a sequence. It starts as stasis eczema, and then if not treated, it goes on to develop, you develop skin thickness. And in severe situations, they can even develop an ulcer, like what has happened here. The other form of eczema is called seborrheic dermatitis. It can affect both infants and adults. So it looks like eczema, but the distribution is a bit different. It tends to affect the head, the scalp, especially the scalp, the eyebrows, behind the ears, inside the ears. So basically the head and scalp region. But it can spread. It can also affect the body, especially the chest and the back. And this is how it looks like in adults. It looks a bit yellowish and dry and scaly. See the eyebrows, and also a bit around the nose. And this eczema is lichen simplex chronicus, otherwise another name for it is neurodermatitis, where you have this uncontrollable and incessant itch to scratch, because it's so itchy, you just feel you need to scratch. And once you start scratching, your skin, you tend to get bleeding because of excoriations. You can develop infection, you can have bleeding. And then what happens in lichen simplex chronicus, your skin becomes very, very thick because of constant scratching and rubbing. So thick skin, it looks something like this. And then there's also contact dermatitis, otherwise sometimes called contact eczema. So in this case, this is called allergic contact dermatitis. It's an eczema rash, but it's due to an antibiotic cream. So some antibiotic creams, like maybe if you buy it over the counter, like neomycin, for example, can cause an eczema rash. So it is an eczema rash, but it's due to an allergy to a specific cream. Other creams that might cause eczema is traditional creams, because we don't know what are the ingredients inside. So it may cause more harm than good. Like in this second picture, this is contact dermatitis. ACD is allergic contact dermatitis, and this one is due to rubber, probably due to from footwear. Your slippers, the sandals that you're wearing, it can irritate the skin and cause an eczema rash. And over here is another cause of allergic contact dermatitis, and this is due to a plant, and this plant is called poison ivy. So you might be going jungle trekking, and then you brush your arm or your leg on this particular plant, this poison ivy, and you see the shape of it. It's in the shape of how you brushed your arm against the leaf. And this is also associated with blister. Eczema can be associated with blisters. It looks like this. So more examples of contact dermatitis. So if you see a patient like this, this is a form of contact dermatitis, irritant contact dermatitis, and this is due to lip licking. Some of us, without realizing, when we're writing or when we're doing something, we tend to lick around our lips, and this is if your saliva is an irritant, then it can cause irritant contact dermatitis, and it's due to lip licking. So some people, when they're writing, they without realizing, they tend to lick around their lips. And irritant contact dermatitis can also be due to disinfectants. Disinfectants, for example, is your hand sanitizer. That's a disinfectant. So eczema is not always red. If in darker skin individuals or skin of color, it can be a bit light brown to brownish. Okay. Whereas in fairer skin, especially the white skin, then you get the typical redness, the classical redness. So this is another example of irritant contact dermatitis due to footwear. And this unfortunate patient has developed irritant contact dermatitis. He has eczematous rash all over his hands, and it's because he's a painter. Okay, so we've come to why we're here in the first place. How am I going to improve your eczema? So what we need to do is, just now I explained the skin barrier is already compromised. So you need to restore the skin barrier. You need to repair it. And then you also need to treat the inflammation. So treating the inflammation with medications that are typical for eczema. And then address the itch scratch cycle, which I showed you the picture just now. When you have itch, you'll tend to scratch, and that will lead to rashes. And then we also have to identify what is causing your eczema, like allergens, infection, and we need to remove all this inflammation. So how are you going to restore the skin barrier? With moisturizing creams. So there are various moisturizing creams in the market. There's ointment like Vaseline, there's cream base like Aqueous cream, there's lotions, there's gel, there's even aerosol spray. So whatever suits you. Some patients, they prefer oily, some patients, they prefer creamy. So emollients means moisturizing creams. So emollients is the mainstay treatment in eczema. It's important in any stage of eczema, whether it's acute or subacute, or whether it is chronic. Chronic means your eczema has been there for a long time, for many, many months. And the type of emollients depends on the patient's preference. So how do you apply emollients? There's a method to apply. You don't rub it on your skin. You apply it and you smooth it or smoothen it on your skin gently in the same direction that your hair follicle grows. So if your hair follicle grows this way, do not smoothen it the opposite direction. Okay, smoothen it along the same direction as your hair follicles. This will prevent your hair follicles from getting blocked. So the purpose of a moisturizing cream is to replace lost moisture. Moisturizing creams, if you are not allergic to it, is very safe. You can apply it regularly, and you can even combine. You can use oily creams and creamy creams as a combination. You don't just have to use one particular type of cream. It's according to the patient preference. So you can apply how often, when to apply emollients, 3 to 4 times a day, especially if your skin is very dry, like in the case of eczema. So you need to moisturize it more regularly, especially if you're working in an office environment. If it's always air conditioned, then and if you have eczema, then your skin tends to be drier. So you can expose areas like your face, your hands. You need to regularly apply. Uh, and also, if you're going to do gardening or if you're going to swim, an emollient can serve as a protective barrier against the potential irritants. Or gardening, because you're exposed to the sun. Sun can also, the sun's UV rays can also exacerbate, cause the eczema to get worse. And if you have a baby, an infant, um, you can apply emollient around the cheeks before the infant's meal time. This is to avoid any potential allergic rash when the cheeks come into contact with any food or any drinks. So emollients is best applied after washing hands, after you had a bath or shower, because this is when the skin needs moisture. Actually, but if you bathe with no soap, you tend to lose a bit moisture in your skin. If you bathe using a soap or shower gel, you lose even more moisture from your skin, because most of the soaps and shower gels are alkali, and your skin's pH is more on the acidic side. So you need to moisturize, especially if you have dry skin in the case of eczema. And after you have applied your moisturizing cream, pat dry. Pat dry, just don't rub your skin with a towel, just pat dry or air dry. So some people just have eczema of the hands. So as you can see in this picture here, the hands are very, the skin on the palm is very dry, and you can see some cracking because it's so dry, the skin has already cracked. So in this sort of eczema, soap is going to aggravate the eczema. All right. So if you have washed your hands with soap, you need to wash your hand again with emollient, or preferably try not to use soap, or use a hypoallergenic soap. Hypoallergenic soap means soaps or cosmetic products that do not contain chemicals that can irritate your skin. Okay, so it reduces the risk of developing allergy. So the best is if you wash your hand with the emollient, like an aqueous cream. Aqueous cream is often used as soap as well, or when you have a bath. So you wash your hand with a moisturizing cream. Emollient means moisturizing cream. And then after that, you pat dry with a soft towel. And then you have to reapply the emollient. And then there are also a lot of soap substitutes in the market. These are known as emollient wash products. So these are some examples like QV Gentle Wash, CeraVe. This is for eczema or any condition that results in dry skin. So what you need to, how to use it, you can just take a teaspoonful on your palm, and then mix with a little warm water and spread it over your affected areas, or if all over your body. And then once you're done, pat dry again. Pat dry again. Do not rub with a towel. So you can use it for hand washing. You can use it during the shower or in a bathtub. So soap substitutes. It doesn't foam like normal soap, and it's more gentle on the skin, and it's effective in cleaning the skin. And the likelihood of causing an allergic reaction is much less because it's tailored for eczema, as opposed to antibacterial soaps that contains a lot of antibacterial components inside, contains fragrances. These are not good if you have eczemated skin, all right, because it will dry up the skin even more, and the fragrance can irritate. It can worsen or even trigger your eczema. What are the safety advice when using moisturizing creams? Okay, some moisturizing creams, like the paraffin-based ones. Paraffin-based ones, the classic example is Vaseline, which you might have seen over the counter in pharmacies. So there is some very mild hazard whereby it can catch fire or flames or cigarette. But in order for this to happen, you really need to heat it up at very high temperatures. So you need not worry too much. But the caution is that just keep it away from flammable stuff. And when you're using a cream or moisturizing cream, make sure you use a clean spatula, and don't use your fingers to dip inside, otherwise you'll contaminate the cream. Use a spatula and then apply on your body. And if you're applying oily moisturizing creams like Vaseline, be careful because it's oily, and if you apply it on the surface of your soles, on your legs, you might slip and fall. Like this poor unfortunate boy here. Okay, so that is restoring the skin barrier. Now we come to treating the inflammation. So treating the inflammation, you will most likely have to see a doctor. So because treating the inflammation, you need to obtain prescription drugs like topical corticosteroids. Now, first, steroid cream, topical means apply on the skin. So steroid cream are the first line agent for eczema. It is good because it takes care of the inflammation. So it reduces the redness, it reduces the scaling. And steroid creams have been it's been an established treatment in many existing guidelines. So we've been using it for a very, very long time, and it works. There are some parents, they have this scare, or shall I say, they feel that steroid creams may be harmful. Now, steroid creams are harmful if you do not apply according to prescription, or if you apply steroid creams that are too strong, because if you buy it over the counter, then you might accidentally buy a steroid cream that is too strong. So if it's too strong or too potent, you shouldn't apply it on certain areas, especially on the face. And what happens is that some patients, they think they can apply it all over the body, but it should only be applied on the areas where you have rash. Your moisturizing cream you can apply all over your body, including the rash sites, but the steroid creams are only to be applied on the sites that have rashes. So if used according to prescription, according to your doctor's prescription, there should be no complications should arise. And you're not going to use it forever. So this is how you're going to use topical steroids. After you've applied a moisturizing cream, 30 minutes later, you apply a steroid cream. The reason is because if you apply it too soon, then the moisturizing cream might dilute the steroid. So it might not work too well. So you wait for about half an hour, and then you apply your steroid cream. TCS is topical corticosteroid, otherwise known as your steroid cream. So initially, doctors will often ask you to apply twice a day. Okay, this is the typical regimen. And then as the rash gets better and the redness begins to get better, subsides, then we can reduce to once a day. And then we can reduce to 3 times a week before reducing to 1 time a week, before stopping completely. So it's not forever. It's just to be used during the acute inflammation phase, when the redness and the inflammation is very, very bad. Okay, and then after that, once it is completely subsided, you're only going to apply your moisturizing cream. But if you have, if your child has a tendency to recurrently develop eczema, then there's this thing called proactive therapy, whereby you use a mild steroid cream, a very, very mild steroid cream. You continue to apply on the sites that you had the eczema, just on the sites that you had the eczema, not all over. Apply 1 or 2 times a week. This is called a maintenance therapy. All right. And the choice of steroids, because we have steroids also come, is just like the vehicle, meaning that it can be a cream, it can be an ointment, or it can be a gel. So gel is probably preferred for the scalp because you don't want to occlude the hair follicles. Cream you can use for anywhere, actually, the face, body, the genital area, and also skin folds. Ointment you can use for the palms and soles, but it's really patient preference. There's no hard and fast rule. So you can go and buy topical steroids over the counter, but some medications, some creams, prescription drugs, only doctors can prescribe. So especially this one, Clodem or Dermovate, these are very, very potent steroids. I've had some patients who buy this over the counter, which should not should not have happened, but they managed to get it over the counter. And for their children, they apply this on the face. So it's a very potent steroid, and it should not be used for too long. It's only applied in specific areas. Therefore, you should always see your doctor and get the correct advice, the correct prescription, and the correct regimen on how to apply these particular steroid creams. So this is very potent. You should not exceed one tube is 15 grams. So you shouldn't use more than 3 tubes a week. Should not use more than 50 grams a week. Okay, so because there's a lot of worry regarding steroid creams, I'll also talk about the side effects. So when you apply the cream on your skin, what can happen is that the skin can become thinner. Okay, so once your eczema rash has already subsided, has already healed, you're not going to apply very, very strong steroid creams anymore. You're going to, your doctor will recommend a milder cream to apply. And once your rash is not there, you can eventually stop your steroid cream and just maintain with your moisturizing cream. And then the other complications that could arise, stretch marks. You might get stretch marks on your skin. And then sometimes it might cause burning or itching sensation. And sometimes it might cause acne-like eruption. Acne means pimples. Pimples usually appears on your face, right? But on areas where you apply a steroid cream, you might get some pimple-like eruptions. And if it's used for a prolonged period of time and very potent steroids, not according to the prescription by your doctors, it can even interfere with your hormones in your body. And it can cause increase in thickness of your hair, and it might also cause infection. So it is very important that doctors monitor your progress and that you come for your regular follow-up so that we can reduce the strength of your creams, and and avoid over-the-counter drugs, traditional creams which you or probably your family doctor does not know what the ingredients might be. And definitely don't use any non-clinical proven drugs, especially drugs that creams that promise to treat multiple diseases, not just eczema, maybe psoriasis, a fungal infection. It just sounds too good to be true. So I thought I might share with you some of the side effects of steroids. Now, mind you that all these pictures of the side effects of steroids, this is called Cushing syndrome, where the child has put on a lot of weight around the stomach, on the chest, on the arms and the legs, and also on the face. So this is because of steroid cream, which was used unregulated and was not monitored. Over-the-counter steroids, too strong, too potent steroids, and used for too long a time. And this is what happens when you use this particular cream for prolonged periods of time, and it goes unmonitored because you're buying it over the counter. Okay, this is another example where the infant has developed Cushing syndrome, also due to steroid creams, not tablets but creams. And these are the skin markings that can occur due to prolonged steroid. This is probably due to very, very strong potent steroids used on the face. Okay, so it is very important for you to come for your regular follow-up, especially if you're on such medications. So how to apply the steroid cream? How to know you're applying enough, too much or too little? So there's this particular guideline here, whereby it's called a fingertip unit. So you see the cream that you apply on your finger here. This is the crease, the distal part, or the end of your finger. So this is called 1 fingertip unit. So 1 fingertip unit is equivalent to 0.5 grams. Okay, if you have very small hands, very small adult hands, like maybe a small lady, for example, you can even take 0.4 grams. But just stick to 1 fingertip unit, 0.5 grams. So in total, this is the distribution of the fingertip unit. So the face and neck is only 2.5. Okay, so 2.5 of fingertip units, not more than that. The back is 7 fingertip units. The front is also 7 fingertip units. Take for example, your palm, one hand is 1 fingertip unit. That means only this much of cream will go on front and back of your hand, front and back. And if you're using both palms, let's say you have hand eczema, then you only need 1 fingertip unit because you're applying on both sides of your palms. That's it. Okay, so this is how you know not to apply too much topical steroid. Okay, it serves as a guide. Now this is for adults. For children, it's going to be different depending on the age. So the distribution of the fingertip unit is different in children. Okay. Let's just take for example 1 to 3 years old. So the face and neck in an adult will be 2.5. In a child is only 1.5. Okay, that's just an example. Take for example the back. In an adult is going to be 7. In a child that's 1 to 3 years old is only 3 fingertip units. Okay, so if besides the steroid creams, there's also this cream called tacrolimus or pimecrolimus. The trade name is known as Elidel and tacrolimus ointment. So this also functions similarly to the steroid cream, but it does not contain steroid. So for children above the age of 2, for acute eczema, if the eczema is in flare, then we can use these creams. And then after the eczema has subsided, we can also use this proactive treatment. Remember just now I had mentioned the proactive treatment for steroid creams. Once the eczema has healed, so already subsided, we use a mild steroid 1 to 3 times a week. So for tacrolimus and pimecrolimus, we can also do that proactive treatment where you apply 2 to 3 times a week only as a maintenance therapy on the sites that you had the eczematous rashes. Okay, so the other way to treat inflammation in eczema is called the wet wrap therapy. So the wet wrap therapy is if you don't have any skin infection and your eczema is very, very severe, moderate to severe, then you can use wet wrap therapy. The other reason why it's good to use a wet wrap therapy is that when you wrap the child like a mummy, the child can't scratch. Okay, so it protects the skin from scratching. Scratching will lead to excoriation, and excoriations can lead to infection. Okay, so wet wrap therapy, these are the step-by-steps. I'm going to show you a video shortly, but these are the step-by-steps. So what you will do is that there's this tubifast. You can first after you need to prepare the tubifast. Tubifast is a tubular bandage. So if you're going to wrap the arm, let's just say the arm is 30 centimeters, you need to measure 60 centimeters. All right, double the length. So you prepare the wet wrap garment by soaking it in water, lukewarm water, and then you dry it. So you only soak one half, the other half it remains dry. So after you've bathed your child, you will apply an emollient. Emollient means moisturizing cream. After you apply the moisturizing cream, you can apply a mild steroid cream. TCS is topical corticosteroid or steroid cream. Okay, so you apply the moisturizing cream first, like Aqueous cream for example, and then you apply the moisturizing cream. And then, okay, step 3 is the steroid cream. Anti-inflammatory means the steroid cream. Okay, the moisturizing cream you apply all over. Okay, but the steroid cream you're only going to apply on the affected sites, on the rashes. And then the tubular bandage just now, I just now mentioned one half of it will be soaked, the other half will be dry. You apply the wet half first, apply the wet garment first over the affected side, and then the dry garment you apply over the wet one. And then you leave it for preferably overnight, like 12 hours. 24 hours is ideal, but it might be not practical in children because it can be uncomfortable. So you can either do it in daytime for 12 hours or overnight for 12 hours for about 1 week to 2 weeks. Okay, I'll show you a video, so it'll be much more clearer for you to see and understand. So this is the tubular bandage that I was talking about. So it comes in many sizes. Red is the smallest size, so this is suitable for children. Whereas purple, you can see here, purple is the largest size. Like for example, if you're going to wrap the body of an adult. Some tubular bandage comes in a garment. You can actually wear a garment, like what this boy here is wearing. So these are the things that you will need. Your moisturizing cream, your steroid cream, your tubular bandage, and probably a basin because you're going to soak half the tubular bandage. Okay, so this will be the first video. Louis, are you there? All right.
Measure the length of tubular.
Okay.
Wet wrap therapy is another useful treatment that can help to provide relief and control of eczema. It is a simple procedure that can be done at home. To prepare for wet wrap therapy, you will need a clean container, water, bath oil, moisturizer, tubular cotton bandages or garments. Measure the length of tubular bandage needed. Fill the container with water. You may add 1 capful of bath oil to the water. Soak 1 layer of the tubular bandage in water and wring dry. Apply a layer of moisturizer to the skin. In addition to moisturizers, your doctor may instruct you to apply a low-potency topical steroid or calcineurin inhibitor with a wet wrap. Then, apply the wet layer of tubular bandage onto the body. Finally, apply the dry layer over the wet layer. Alternatively, you can use a full-sleeved vest or full-length pants of an appropriate size. You can repeat this whole process when the wraps become dry. Wet wrap therapy is best done during the day when re-wetting can be done. Applying wet wraps at night before sleep may reduce scratching at night. If there are signs of skin infection, avoid using wet wraps until the infection has been treated.
Okay, so that was how you do wet wrap therapy. So if there's a skin infection, if there's a lot of excoriations, you need to treat that first. We need to treat that first, probably with some antibiotic cream or course of antibiotic tablets before you can do wet wrap therapy. So if you're not sure, you should always consult your doctor first before doing the wet wrap therapy. So the next mode of treatment, also to treat the inflammation, is another option would be phototherapy. So phototherapy can be combined with your steroid creams and moisturizing cream. If your creams alone are not enough to control the eczema, then what we can do is add on phototherapy. So phototherapy is usually for moderate to very severe eczema in patients who fail to respond to the conventional treatment. So it's available in government hospitals that have a dermatology department. And the advantage is that it can improve the disease severity and reduce the itch, and can also help you sleep better at night. So there are many other drugs which I will not go through in detail, like oral medicines for eczema. So quite often, oral steroids are given to eczema patients. You can give oral steroids for a short course, maybe about 1 to 2 weeks, just to reduce the inflammation. But you can't give for prolonged periods. The same thing goes like if you were to go to a clinic, for example, and you get a jab. So that jab is usually a steroid jab, and you will see that your symptoms improve immediately. But when you, after a few days or after a week or so, symptoms will tend to recur. All right, so there's a rebound of symptoms. So taking oral steroid tablets also needs a proper prescription and regimen by your doctors. So these are the other options for oral medications. And then there are also much more better drugs now in the market, like injectables, where like dupilumab, for example. This injectable is given every 2 weeks or every 4 weeks. And these are other form of oral drugs, and also creams. And this is also another example of a cream, all used for eczema. So we've going to address the itch scratch cycle now. So this is just a diagram to show that when you have an itch, you'll start scratching. When you start scratching, you damage your skin, and then when you damage your skin, you release a lot of inflammatory chemicals, and this will result in your skin becoming very dry, very red, and you start developing scaling. So what can you do? You can take oral antihistamines. Antihistamines are the same medicines that you take for your flu. And then we discussed about wet wrap therapy. That's an option. Phototherapy, which I showed earlier. And I've colored. The emollients are very, very important because you need to regularly apply emollients 3 to 4 times a day. Sometimes even more frequent. Like sometimes we ask parents to apply, especially infants with eczema, every 3, sometimes every 4 hours, if the skin is really, really dry. And then we also have gone through topical corticosteroids, steroid cream, and then topical calcineurin inhibitor, which is the non-steroid cream, like pimecrolimus and tacrolimus, which I showed earlier. Oral and injectable drugs in the previous slide. And we're going to go to removal of inflammation drivers in a while. So each scratch cycle, what you can do to reduce it, you can use gentle skin cleansers, which are hypoallergenic. Hypoallergenic means there's a lesser risk of it causing an allergic reaction. Avoid potential itch triggers. If you know what is causing your itch, then you have to avoid it. Clothing, cotton clothing, soft breathable clothing is preferable. And sometimes if you have an itch, if instead of scratching it, without realizing, we tend to scratch when you have an itch. You can try pinching the skin. Pinch and pat the itchy skin instead of scratching. Okay, that might help. And if you're allergic to pollen, then you have to probably avoid sitting on grass and even carpets, because carpets harbor a lot of dust mites. Okay, some remedies which you can use at home to address the itch scratch cycle, like for example, the first one here, the colloidal oatmeal bath. Colloidal oatmeal is different from your regular oatmeal. Colloidal oatmeal can be used either as a bath. That means you will pour some of the colloidal oatmeal into your bathtub, or you can apply it as a paste directly on your skin. So this has been shown, according to some researchers, like the one I've mentioned down here. It has been shown to be beneficial to reduce the itch scratch cycle, because colloidal oatmeal contains a lot of antioxidants, anti-inflammatory, that can help reduce the itch, and it also helps to attract or keep moisture on your skin surface. Okay, so it helps in hydration as well. The other option is baking soda bath, where you'll need a bathtub, or you can apply it directly on your skin as a paste, just like colloidal oatmeal. So 1/4 cup baking soda to a bathtub. So this also has been researched and shown to have some benefit in patients suffering from atopic eczema. Okay, so this picture here is some of the examples of colloidal oatmeal, like Aveeno, for example. Now, you might have may or may not have heard of other options like apple cider vinegar bath. So although, so is it good or bad? So the research for this is not very convincing. So you probably want to avoid apple cider vinegar because it contains acetic acid, 0.5%. Salt bath is also a no-no. Probably you should avoid salt baths. And other options of addressing the itch scratch cycle, acupuncture has also been researched. Acupuncture has been shown to improve the circulation. So it may have some benefit, as I mentioned, that it may have some benefit in reducing the symptoms and itch in atopic eczema. But if you have a lot of excoriations and infection, you probably want to avoid acupuncture. And applying a cold compress on the skin also provides relief for the itch and also for the inflammation, because when you have inflammation, the skin tends to be more red and might be a bit warm as well. Okay, so we've come to the last part where treating the inflammation drivers. So these are all the inflammation drivers which you need to be aware of because these are things that you can tackle or treat on your own. You can look into it on your own, like house dust mites, your pets, pollen and mold, the food. Central heating is mainly for countries with winter, not in Malaysia. Cleaning, how thoroughly you clean, your bedding, your laundry, and also infection. So the first is food. So what are the common food allergies associated with in eczema? So these are the usual culprits: cow's milk, soy milk, peanut, egg, shellfish, wheat, fish, and other tree nuts like almond, walnut also can cause food allergies in eczema. Okay, what is the likelihood of infants and young children with eczema developing food allergy? So it's about 30%. 30% of children or infants who have eczema can develop food allergy. So if they already have eczema and they take something they're allergic to, then the eczema gets worse. They scratch more, they develop more redness, they may develop rashes in other sites, in new sites. So the eczema becomes more difficult to control. Can food allergies aggravate eczema? Yes, up to 10 to 30% of infants and children can develop worsening eczema. Okay, how soon can you see a patient develop food allergy? You can see within 30 to 60 minutes. That's how fast it is. They can develop wheals. Wheals is hives. Can develop itching. Can develop rash. Once you scratch and itch, it itches because you scratch, so you can develop rashes. And then as the food comes into contact with your mouth, you can develop swelling around the mouth or swelling around the face. Okay, and diarrhea, vomiting as well. Sometimes the reaction is delayed. After 1 or 2 days, then they can see the reaction. So if just now I mentioned all the usual culprits like wheat, egg, soy, peanut, cow's milk, fish, shellfish. So should the usual suspects be removed from the patient's diet? All right. Just because they are the usual suspects of common food allergies, not just in patients with eczema, while they are the common food allergens, it may not be the cause of allergy. Okay, so the usual suspects may not be the cause. So if you unnecessarily eliminate some of these usual suspects, it could deprive the child of nutritional needs. Because egg, for example, is nutritious. It contains proteins, choline, a lot of proteins that a growing child might benefit from. Okay, so you don't need to unnecessarily eliminate. I will show you a slide later regarding egg allergy. If common food allergens were removed from the diet, is it still possible to develop the food allergy in the future? Yes. Okay, let's just say your child is allergic to egg, you remove egg today, and then maybe in a couple of months or a couple of years, you decide to reintroduce egg. Yes, the child can still develop food allergy. So these are the symptoms of food allergy: wheezing, hives, skin rash, watery eyes, runny nose, irritation around the lips or inside the mouth, And anaphylaxis is a very severe allergic reaction. You can develop swelling inside your airway, and you can develop breathing difficulty. So this particular anaphylaxis, you will require emergency treatment. You need to come to the hospital. And then there's this thing called pollen food allergy syndrome, whereby let's just say you're allergic to pollen, for example, maybe tree pollen, grass pollen, wheat pollen, or any pollen. So that's called pollinosis. So if you're allergic to pollen, and then you take, let's just say you're allergic to grass pollen, for example, and you were to take orange or tomato or watermelon or kiwi, you can develop a cross reaction, meaning because you already have existing pollen allergy and you take other fruits or vegetables, it could aggravate your eczema. And this is known as pollen food allergy syndrome. It usually starts in during preschool children, and it's also common amongst adults. Okay. Is cow's milk helpful in reducing the risk of eczema? All right. The infant formulas are mostly derived from cow's milk, so they have been produced so that it resembles resembles breast milk and has almost the same nutrients a growing infant requires. So most babies, they can tolerate cow's milk, but some babies can develop cow's milk protein allergy, CMPA, which can aggravate eczema. So if you see your child having stomach cramps, when they have stomach cramps, they might arch their back, or if the child has wheezing, constipation, that means difficulty to BO, poor feeding, reflux, vomiting, eczema gets worse, diarrhea, then we may need to suspect cow's milk protein allergy. Okay, how common is it? It's not common. Okay, in the first year, it's only about 2 to 6%, so it's pretty rare. Okay, it's not that common. And the good news is that by the age of 1 year, nearly half of children who develop cow's milk protein allergy will resolve, and within 5 years of age, 18 to 90% will also resolve. So if you have cow's milk, if the child has cow's milk protein allergy, what other options are there besides cow's milk? So is hydrolyzed formula milk suitable for patients with atopic eczema? So this is a few examples of extensively or partially hydrolyzed milk. So these are called more gentle formulas that can help reduce the risk of allergy in infants who have atopic eczema. Right, so these are some examples. But the best milk is still breast milk. Breast milk is, according to the American Academy of Pediatrics, breast milk is a superfood. It provides all the necessary nutrients, calories, and fluid that a growing baby needs. And only 2 to 3% of babies that are breastfed may show signs of allergic reaction to the food, not to the breast milk. Okay, so this is because if the mother takes something that may cause allergy to the infant, so there are trace amounts of that food, trace amounts of protein contained in the breast milk. This is the proteins from the food that the mother eats. But the incidence of allergy is very, very low. It's only about 2 to 3%. So the American Academy of Pediatrics, this is based on their recommendation, you can attempt to introduce egg, peanut, soy, or wheat at the age of 6 months, or whole milk, yogurt, cheese, also at the age of 6 months. But they recommend cow's milk until after 1 year old. Right. Now, why does the mother need to be well fed? The mother should not restrict her diet too much, because then the mother will be lacking from certain nutrients and proteins that the mother requires to produce an adequate or sufficient amount of breast milk. Okay, so it is therefore very hard to successfully breastfeed on a restricted diet. So the best milk is still the breast milk, and the other reason why is because it's also free of charge. Will avoiding the common food allergens cure eczema? Not likely cure, but it can help to reduce the symptoms. So these are some of the symptoms which I went through earlier, symptoms of food allergy. Food allergy and food intolerance is different. Food allergy is these symptoms: hives, vomiting, diarrhea. But food intolerance is like bloating, gas, blood in the stool. So if the child develops food intolerance, then you need to avoid the potential foods causing that allergy. Egg allergy. So these are all the components in the egg that can cause allergy. Right? There are 6 major egg allergens. So the highest is in the egg white, over milk white. So this is the most allergenic. So what to do if you're allergic to egg? This is one guideline which you can Google on your own on this website. Protocol. Let's just say your child is allergic to egg, and you want to reintroduce egg. So what you can do is that you can follow this recipe. They give you a recipe on how to make a fairy cake, where this is a recipe: 1 egg, 4 ounces of cell raising flour, margarine, castor sugar. So you can make 8 fairy cakes. But to do this, your child must be able to tolerate cow's milk. Okay, if you cannot tolerate cow's milk, if you're allergic to cow's milk, then you cannot do this protocol. And then you also have to have some antihistamine available. But if your child has had anaphylaxis, anaphylaxis is a severe reaction, severe allergy because of egg, then do not do this. All right, this protocol is not recommended. So what they do is that after they made the fairy cake, they will take a bit of the fairy cake, rub it inside the lip, and then observe for about half an hour, see whether there's any allergy reaction or not. Allergy reaction means like itching, redness, swelling, hives, vomiting, wheezing. Okay, and if there are no symptoms, then you can give a small amount, pea-size amount, the size of a pea. And then the following day, you can give double that amount. So symptoms can be delayed. Sometimes it takes up to 2 hours for the symptoms to occur. So this can actually be repeated using, initially you will use 1 egg, and then if the child can tolerate, then maybe you can use 2 eggs. So that's how you slowly reintroduce your child. If the child had egg allergy before, this is how you slowly reintroduce egg. This is just one of the methods which you can Google and read about it on this website, British Society of Allergy and Clinical Immunology. Right. So there are so many foods that can cause contact dermatitis. So these are some of the foods that can cause contact dermatitis. If you to see all these foods, you might not want to eat anything, because banana, fig, kiwi, lemon, pineapple, some of the some common foods that you might take. Grains like rye, barley, wheat, latex. Make sure you wash fruits properly, especially if you've taken it, if you just bought them from the market. Any meat can cause protein contact dermatitis, not just fish and shellfish. Seafood, beef, pork, poultry, minced chicken also can. And then mites, we're going to talk about mites in detail afterwards. Nuts, spices, vegetables, animal dander, your household pets. So this picture here is a patient who makes who comes into contact with wheat because she makes bread. So she has developed wheat allergy. You can see there's redness and dryness on the palms. So certain foods can cause contact dermatitis or irritant contact dermatitis, like the ones I mentioned here. So you want to, if you have an allergy, then you have no choice. You either have to avoid the potential irritant, or you have to wear protective gloves. So food preparation in a patient who has contact dermatitis, like in this picture, for example, it looks like hand eczema, but in this case, it's contact dermatitis due to certain chemicals or disinfectants or wheat, in the case I showed you earlier. So it's preferable that you wash your hands with hypoallergenic soap or an emollient, like what I explained earlier for the hand eczema. And after that, pat dry or soft towel. Use a soft towel to pat dry, and then reapply the moisturizing cream. So you have several options for gloves. This is called the powder-free glove. We sometimes use this in hospital for doctors or nurses who have allergy themselves, so they can use this powder-free glove. It is the powdered glove that sometimes can cause allergy. And then there's other types of gloves like tencel. Tencel is softer than cotton. Bamboo is also softer than cotton, or 100% cotton gloves. Okay, so infection can trigger eczema. Can make your eczema worse. So if there's infection, we need to treat it. Whether it's an ear infection or infection affecting around the nose, around the mouth, these are common bacterial infections that can occur, or viral infections. So you need to come and see a doctor. We need to treat the infection first. If you don't treat the infection, then it's very difficult for the eczema to be controlled. What we can do, we can give antibiotic cream, we can give you a course of oral antibiotic, or there are antiseptic baths like chlorhexidine bath, octinisan, triclosan. So this is the skin from because it itches. So the patient scratches lead to excoriations. These are all excoriations due to scratching. So antibiotic creams also you can buy over the counter, but please be careful. Try not to do that because some antibiotic creams, for example, like Fusiquat, also contains a steroid. Fusidic acid is only a antibiotic cream. Fusiquat contains a steroid, and the steroid is potent. You cannot use it for prolonged periods. Only during the acute eczema phase. And another way to get rid of your infection is called a bleach bath. So a bleach bath is actually using your Clorox, your household Clorox, 6% or 0.005% sodium chloride. So you will fill up a bathtub, about 150 liters, which is about 40 gallons, and then use half a cup of bleach. If you fill up half a bathtub, then you just use 1/4 of bleach. So you can do this 2 to 3 times a week, soak for about 10 minutes. So a bleach bath will get rid of any infections that you might have. If you don't have a bathtub, then the other option is in a swimming pool. Okay, a swimming pool has the same effect, but in a swimming pool is also treated with other chemicals like chlorine, which can which can aggravate your eczema. Okay, so this is the most interesting part of the topic, house dust mites. Okay, these house dust mites, they are relatives of arachnids. That means they are like spiders. They have 8 legs. They look like spiders, but they're very, very much smaller. And the bad news is that you can't see them, but they're always there. So these tiny creatures are found in your household. Any household will have dust mites. If there's dust, or if there's no dust, dust mites will be there. It's so small you cannot be seen it by the naked eye. So what triggers the eczema is the protein in the mite poop. The protein in the mite poop can worsen the eczema. Okay, and mites, they thrive at this temperature. So ideal temperature at home is about 18 degrees Celsius, because mites, they thrive at this temperature, 20 to 25. So this is a bed bug. A bed bug is still visible, and this is a dust mite. A dust mite is microscopic. You cannot see it with your naked eye. So just for entertainment purposes, a bed bug is about the size of maybe an ant-man on his hand, and a dust mite is just as small as a tardigrade. See, this is ant-man riding a tardigrade. So tardigrade is very, very small. It's 0.05 millimeters, and a dust mite is almost as small. It's about 0.5 millimeters. It's about 420 microns in size. So you can't see it, but it is there. So regardless how well you clean your house, if you have an obsession for cleanliness, you keep on vacuuming and cleaning and mopping, you're never going to get rid of it. It's going to be there, but you might reduce it. If you reduce the amount of dust at home, it will definitely be beneficial for your eczema, but your dust mite will remain. So this is a picture of a dust mite eating a dead skin cell, probably a human dead skin cell. And this is a picture of a dust mite in the carpet. So how to overcome? All right, you can use a damp duster, wipe your dusty surfaces, shelves and whatnot. You can add a bedroom and living room to reduce the humidity. You can use a dehumidifier. You need to wash the bed linen in hot water at least 60 degrees Celsius. And if your washing machine has tumble dry option, that's a convenient option. Tumble dry clothes at a hot setting of 60 degrees will help destroy dust mites. And then there are also anti-dust mite mattresses, pillows, and duvets. But these are costly. Although might be helpful, but it's costly. And how you store your things. It's better you store your things in a enclosed display cupboard. Like this cupboard is enclosed, so it doesn't accumulate much dust. Instead of keeping your things exposed like this, like your toys in the cupboard. And avoid keeping toys in a child's cot. Especially, I say, all these toys in a child's cot. Not only does it harbor dust mites, it's also hazardous. In this statistic, it is said that the CDC reported that 665 babies died from accidental suffocation or strangulation while in bed. So don't cram the bed cord with too many toys. Or this is another good example where everything is kept in a cupboard, and you can see it is enclosed. This is the cupboard door here. So probably your soft toys, especially furry soft toys, also can have house dust mites. And we probably don't do this often enough. Washing regularly. Wash the soft toys regularly. Put your teddy bear or whatever bear inside the washing machine at a temperature mentioned earlier, 60 degrees, if possible. Or if the toy manufacturer says you cannot wash it, then you can place it in the freezer. You put it in a plastic bag, put them in the freezer for about 24 hours, and after freezing, you just brush off whatever droppings are there, so the dust mites will fall off. Okay, so vacuuming cupboards and soft furnishing at least once a week. I know most people, they do it even more than that. Some every other day, some daily. So especially carpet seams. This is a seam where the carpet has been joined. So these seams will have a lot of dust mites. Okay, so replace carpets with seamless floor if you can, with resin or linoleum. If you have carpets, preferably you get rid of them, but if you can't get rid of them, put a protective cotton cover cushion over the carpet. Especially in nurseries and school, you might want to do this if your child attends nursery or in school. If they have to sit on a carpet, use a protective cotton to cover it. And wood, vinyl, and laminated floor would be easier to maintain, to clean. And you can also opt to use a anti-dust mite spray. Don't forget to wash and dry clean the curtains and cushion covers, also at this ideal temperature of 60 degrees Celsius if you can. And curtains, especially roller blinds, they tend to reduce dust mite carriage compared to regular curtains. And soft furnishings that can be wiped down, like vinyl or leather, would be preferable rather than cushions. Okay, so this is my next video. Please enjoy this video. Now, this is by ENT. I got it from this website. It's for ENT, especially ear, nose, throat. So it will show what allergies you can develop due to dust mites.
Nothing better than falling asleep into a nice clean bed.
Wait, let me start from the beginning.
There is nothing better than falling asleep into a nice clean bed, but not so nice when your nose often gets stuffed up or congested after laying down. The culprit may be what you are also sleeping with at the microscopic level, no matter how clean the bed appears to be. Known as dust mites, these microscopic arachnids are virtually invisible to the naked eye, being only 0.2 to 0.3 millimeters in size. Dust mites and their excrements are one of the most common indoor allergen, causing people to suffer an allergic reaction whenever laying down to sleep. In the average bed, there can be anywhere from 100,000 to over 2 million dust mites. In fact, in a typical 2-year-old pillow, 10% of the weight could be attributed attributable to dead mites and their excrements. Living off dead human skin that people shed daily, dust mites also live on furnitures, carpets, and even stuffed toys. While it is impossible to completely rid a home of dust mites, there are things that you can do to diminish their presence. One step you can take to prevent an allergic reaction to dust mites is to use special allergen impermeable covers on both your mattress and pillows. Such dust mite covers have pores that are too small to let the dust mites and their waste products through into the bedding where you can breathe it in. No matter what material the cover is made of, choose a zippered version for the most effective protection. Consider purchasing covers for not only the mattress, but also the box spring and pillows. Regularly wash all bed linens, including sheets and blankets, in water that is at least 130 degrees Fahrenheit, which kills the mites. For further defense, remove as much carpeting as possible, as well as use special air filters to clean the air as much as possible. Over long periods of time, continued exposure to dust mites will trigger not only nasal symptoms, but also can result in asthma and chronic coughing. An allergy test can be obtained to confirm whether a dust mite allergy is present. Ultimately, medications all year round and even allergy shots may be required for complete symptom control.
Okay, so I think the internet connection was a bit lagging. So the reason why I showed this video is that house dust mites, it can trigger eczema. They can also trigger a lot of other things like your rhinitis. So if you go to sleep, for example, and you find that your nose is always blocked, maybe one side is blocked, or maybe both sides are blocked, and you can't breathe properly, when you're sleeping and you snore a lot, it could very well be due to dust mites. It causes congestion, and if you have asthma, it might also trigger or worsen your asthma as well. Okay, so the next is pets. Now, pets, because the animal dander, so they shed skin cells, the saliva and the fur, all can be irritants. So after you have picked up your pet or stroked your pet, you have to wash your hands, especially if you have sensitive skin, like in the case of eczema. Vacuum and damp dust regularly. And you could train your pet to use their own pet bed or basket rather than the sofa, which you regularly sit on. So perhaps you could train your pet to also prevent them from coming into your bedroom, sitting on soft furniture. And if you could also place a pet blanket, which can be removed, shaken and washed regularly on the pet's favorite armchair. And you should avoid sitting on this particular chair. Would it be useful if you rehome your pet? That means you take your pet out of your house, place it somewhere else for your symptoms to improve. Well, it can take up to 8 weeks for a pet allergen to be reduced within the home, even after you remove the pet. So quite interestingly, some pets, although cats are known to trigger your eczema and other allergies, some cats are known as hypoallergenic cats. You have hypoallergenic cosmetic products. You also have hypoallergenic cats. So allergens responsible for cat allergy is known as FeLD1, It's a protein found in the cat saliva. So the cat licks you, it might, and if you have eczema, then it can irritate your skin. So this protein usually spreads throughout the animal's fur during grooming when the cat licks itself. So these are some of the cat species that have been classified as hypoallergenic. So if you have eczema and you really love cats, then maybe these are some of the options for you. If your eczema is really not controlled, and you love your cat too much and you don't want to get rid of it, so perhaps you could look into alternate options. Okay, so all right, so these are some of the options for hypoallergenic cats. Okay, so pollen. So grass pollen, wheat pollen, tree pollen, in all sorts of pollen, even rye pollen, can be problematic, especially during countries with spring and summer. So what you could do is stay indoors, but if you need to go out, there's just no two ways about it. And you can stay indoors, close your windows on days where pollen count is high. You can actually go online and check the pollen count in your country, from country to country and location using GPS. And you could avoid hanging clothes and bed linen outside to dry, otherwise they'll be exposed to pollen, and dry the clothes inside instead. This is if you're really sure that pollen is the primary trigger of your eczema, then maybe you have to go through such extremes. And don't forget about the plants inside your house. Consider whether any household plants could be triggering your eczema. So you need to, if they are, then you have to vacuum and damp dust regularly. The other driver of inflammation is mold. So mold is, you see this mold build up by the side of the wall. Sometimes you might see it in your bathroom because it's very damp. So mold, they release spores, and these spores are inhaled. They inhale and it can trigger your eczema. So any damp areas, especially in the bathroom, you have to clean all these areas with either diluted bleach, and you need to keep the rooms well ventilated, and ideally 18 degrees Celsius. Even for house dust mites, 18 degrees would be the ideal temperature to avoid mold buildup. Cleaning. So when you're cleaning, either when you're vacuuming or if you're using any disinfectants, and if you yourself have eczema, be sure to wear your protective glove. Bedding. So the choice of bedding, there's multiple choices of bedding, but preferable if it's 100% cotton bedding. There is such a thing as anti-allergenic covers, which you saw in the video just now, where they cover the pillow with a anti-dust mite cover with a zipper. So you can cover the pillow, you can cover the mattress, but it's most likely very, very costly. So dust mites, just like how we saw just now, they're very small. You don't see them, they're microscopic. So you can see these two dust mites here. What are they doing? Do you ever look up into the endless bedding and feel insignificant? Yeah, because all they do is just eat your dead skin cells. They got nothing else to do. So at one point, if your pillow is very, very old, and if you buy your pillow, it weighs a certain amount, but after 2 years or more, your pillow weighs much more, seems to weigh more, then your pillows might be harboring a lot of germs, especially if it looks like this, a lot of house dust mites. So you're basically sleeping on a pillow infested with dust mites, like in this depiction here. So roughly a pillow that's more than 2 years old, 10% of its weight comes from dead dust mites and dust mite poop. Sorry, the poop went up a bit. Skin cells a person drops in a day can feed 1 million dust mites. So we're actually feeding them, because we shed our skin cells, and this feeds dust mites. So this is how they look like. So probably tonight you can just imagine you're sleeping with 100,000 to 10 million microscopic dust mites, which you don't see on your mattress. So with that thought, can you really sleep, after seeing my presentation? Laundry. Okay, things that can be helpful. Maybe you avoid fragrance detergent, or detergents that contain chemicals that can irritate sensitive skin, like an eczema. So there are detergents that are fragrance free, Like this one, for example, this has been dermatologically tested. And there's also this device called the 𝐒𝐤𝐢 ball. So inside this device, there is a lot of ceramic mineral stones, ceramic mineral stones, small stones, which you can put inside a washing machine, and it effectively cleans the clothes without any harmful chemicals. It's non-toxic, it's organic, and there's no fragrance to irritate your skin. So when you washing also, there are a few basic things that I'm sure that some of you already practice. I mean, if you're using a new detergent, you might want to wash a few clothes first if you're worried that that detergent might irritate your skin. Bedding temperature, once again, this temperature at 60 degrees Celsius. If your washing machine has tumble dry, that will be effective in destroying dust mites. And after you use the washing machine, leave the washing machine door open. Otherwise, you have mold buildup, like what's happened here in this picture. And avoid overloading. Obviously, overloading, you're not going to get an effective wash. And don't use too much powder or liquid. And washing machines, there are some, most of them now, they have this empty washer where you wash the washing machine once a month at 90 degrees Celsius. And this will be useful in patients with eczema, because when you apply emollients, these emollients are stuck on your clothes, and that emollient can actually damage the rubber. The emollient can build up and damage the rubber lining in your washing machine, rubber seal. Okay, central heating, I will not go through in detail, because most homes in Malaysia don't use central heating. This will be mainly for countries that has winter, so they have a central heater, which they turn up to heat up the house because of extremely cold weathers. So the ideal temperature, again, I just emphasize, is 18 degrees Celsius. So this is a guide to manage eczema. I'm almost at the end of my presentation. So when your eczema is under control, it's the green, this green picture here. So it says that when you bathe your child, don't bathe more than bathe twice a day or once a day, less than 10 minutes. And then after a bath, you air dry or pat dry. Don't rub with a towel. And once you're dry, apply a moisturizer immediately. All parts of the body, 3 times a day or 4 times a day. And depending how dry your skin is, bath and moisturize your skin before bed, and wear cotton pajamas. If your eczema is worsening, then you go to the yellow smiley, or not so smiley anymore. Here you can yourself can still attempt to apply. These are mild steroids. So for the face, you can apply twice a day for 1 week, and then if it is improved, you can reduce it to once a day for another week. And for the body, you can also apply another mild steroid for twice a day, and then for 1 week, and then once a day for another 1 week. And then you can also give your child an antihistamine to help with the itch. If the eczema gets better, then you go back to green. But if the eczema gets worse, then you go to red. Once you're already in the red section, you need to come and see a doctor. All right, because the steroid creams that a doctor would prescribe would be more potent, more stronger. And it is better that you get the counseling, eczema counseling, from a trained doctor. Okay, so this will be my last video, because I know that I've taken up a lot of time. But so this last video will give a summary of the presentation. So we can start now. Okay. The internet is okay.
There are many factors that trigger eczema. Avoiding or anticipating these triggers can minimize eczema flares. Here are 6 common triggers that you should watch out for. As your child's skin is sensitive, it is important to clean it thoroughly and carefully. Use fragrance-free mild soaps or soap substitutes that are suitable for sensitive skin. During a shower or bath, use tepid or lukewarm water. Do not use hot water, as that can worsen eczema. Take short baths or showers of 10 minutes or less. Avoid wet wipes or baby wipes as they may contain ingredients that can trigger eczema. Avoid smoking as smoke particles can cling to fabric and irritate the skin. Hot and humid weather or cold and dry weather can trigger eczema. It is best to stay indoors in a cool and well-ventilated room during hot and humid days, as excessive sweating can worsen eczema. Wear loose-fitting cotton clothes and use a clean towel to remove sweat. Remember to moisturize more frequently when traveling to a cold country. Items like bed sheets, carpets, and soft toys can contain dust mites. To reduce dust mites, change the bed sheets weekly and wash them in hot water of at least 60 degrees Celsius. Dust mites and pet fur may trigger your child's eczema and are best avoided. Falling ill, for example, with fever, cough, or flu can trigger an eczema flare. Broken skin from frequent scratching may lead to skin infection that worsens eczema. Children with eczema are more sensitive to insect bites, which may further worsen their eczema. Use mosquito patches or insect repellents to prevent insect bites. Stress is a very common trigger for eczema. You may notice that your child starts scratching when he or she is stressed, angry, or upset. Food allergies do not commonly trigger eczema. If you have any concern, please consult your doctor. Eczema may still flare despite your best efforts to remove or minimize triggers. Hence, maintaining good control of your eczema is important.
Okay, so I hope you enjoyed that last video. It basically summarizes my presentation and refreshes your memory. Yeah? So these are my references, and this is my last slide. So probably today you can go back and check your mattress, check your pillow. If it looks anything like mine, you probably need to replace your pillow. You never know, it might do wonders. If you have eczema, you could improve your eczema. If you have any nasal allergies, it could improve. Well, with that, I hope you have learned something and about eczema and the things that you can do at home. Hopefully this has been beneficial to you. Thank you.
Okay, all right, Doctor, we will jump into the Q&A. Okay, the first question. Hello, Doctor. What is your opinion on the use of coconut oil or sunflower oil? How would you advise parents who are adamant in using steroids on their child despite having severe eczema?
Okay. Coconut oil and sunflower oil you can use. There's no, it's not prohibited. You can use as a form of moisturizer, but you want to avoid olive oil. Olive oil tends to be inflammatory. And regarding the use of steroids, I know a lot of parents might be concerned when they hear steroid. They always associate it with a lot of side effects. So if you're using it according to the prescribed regimen given by a doctor or dermatologist, you're only going to apply it on the areas that have the rashes. So the areas that have the rashes are usually a bit thicker. So you're only going to apply it on that area. And before you apply the steroid cream, you're going to apply a moisturizing cream first, all over the skin, including the affected area. So, as I said, it's not long term. Once the eczema has subsided, we can reduce the strength of the steroid cream and ultimately stop it. Okay, so as long as you're coming for your follow-up and the doctors can monitor you, there should be no concern.
Okay. So second question, in your opinion, what are the cardinal signs that should prompt a GP to refer a case of eczema to a dermatologist for management?
So what are the what?
Cardinal sign.
Uh-huh.
That means in what circumstance that a GP should actually
Okay.
refer to a dermatologist where they cannot manage by themselves.
Okay. So if you find that the eczema is not improving with the conventional treatment, then whether you're dealing with eczema in the first place, or some other dermatosis is mimicking the eczema, because then the cardinal signs, eczema has a myriad presentation, like I showed you the types of eczema. Yeah, dyshydrotic, discoid, atopic, and then contact eczema, which is contact dermatitis. So there's an extensive history that you need to take, maybe the patient's occupation, their cosmetic products, atopy, what they could possibly be allergic to. Is the eczema getting worse due to UV? Is the patient using sunscreen? There's a lot of questions to ask. So if you are overwhelmed, you can always refer to your nearby dermatologist, and or you can ask these questions yourself and see whether you can get to the bottom of what is triggering the eczema and why it's not improving. Have you treated the infection effectively? Have you tried giving a course of short prednisolone? And if you come to this stage, then probably the eczema is too severe, and the child or the patient might most likely need phototherapy in a government hospital, or systemic drugs like azathioprine, cyclosporin, or even methotrexate. And they're already at that level.
All right. Okay. Third question. Hi, doctor. If a person have very bad eczema on both hands, is it still encourage them to actually wear latex gloves, especially nurses? Now, this is coming from a nurse.
Okay. So if you have eczema, then you probably should not wear latex glove, because those are powdered gloves, especially because when you slap it on your hands, there's powder. So the option would be the powder-free, the nitrile powder-free gloves, which most hospitals have. But sometimes some patients also complain of irritation when they wear the powder-free one as well. So the other options would be, what are you doing to aggravate your eczema? Because if you're in the hospital, you're going to wash your hands with antiseptic soap, what do you call your disinfectant, which contains alcohol, so it dries your hand even more. So you probably need to carry your own hypoallergenic soap, or the small hypoallergenic soap, or lotion when you wash your hands, or bring along your emollient to wash your hands, and use a powder-free glove, or the other options would be a 100% cotton glove, or bamboo or tencel glove, which is softer than cotton. So these are the steps that you can try to minimize your skin rash. If your eczema is really out of control, then we need to get it treated first. You need to be on a topical steroid and continue your moisturizing cream. And if you have infection, then we need to treat that as well.
So I think we just go on the last two questions. No time for the rest of the question. Okay. Can eczema pass via genetic? I mean, is it a genetic thing?
Yes, there is a genetic predisposition, mutation to the filaggrin gene, FLG and FLG1 mutation. So that was the outside in theory, which I showed you in my first few slides. So the outside in theory is if you have filaggrin mutation, then your skin barrier is already compromised. So when your skin barrier is already compromised, it allows anything from outside, like infection, allergens, irritants, to penetrate your skin and cause your eczema symptoms.
Okay. Hi, doctor. Can steroid cream be reused after more than 2 months?
If the expiry date is already nearby, then you need to replace it.
Okay. Okay, now this is the last final question. Can strawberry skin be treated? It causes itchy, redness, especially in cold temperature. Strawberry skin.
Strawberry skin.
Can strawberry skin be treated? Is this some kind of skin condition
In cold temperatures, huh?
in cold temperature?
All right. So in cold temperatures, the skin tends to get more drier than usual. So you need to apply your moisturizing cream more regularly. So the best moisturizing cream that you could apply to maintain moisture is probably the occlusive ones. So occlusive ones, for example, is the Vaseline and or paraffin. So they trap, they prevent water from escaping your skin surface. So more regularly means if you're applying it 3 to 4 times a day and it's not doing the job, then you need to apply it every 3 to 4 hours more regularly, because in extreme cold weathers, your skin tends to be drier. Other forms of moisturizing creams that you can use are like humectants. Humectants is, for example, like your aqueous glycerin, even your colloidal oatmeals, humectant, because they keep your skin well moisturized. It keeps the water close to the skin surface. So regular moisturizing creams, especially in extreme weathers.
All right, I think that's the end of our session. Before I end it, let me show the QR code for the E to mark the attendance. Yeah. Okay. Now, nurses, this is the QR code that you need to scan it now in order to actually for us to capture your attendance, and hence we can actually send you the e-certificate by this week. All right. So just give another. Okay, this is also applicable to pharmacy, because I do see some pharmacists that are joining the talk today. Yeah, whoever that require an e-certificate, you can actually scan it now, and for us to actually for you to get the e-certificate. Yeah. Okay, I suppose that this is done now. If it's not done, then you can actually share with your friend, okay? Share with your colleagues and all. All right. Okay. Thanks for doctor for your very solid, comprehensive lecture as usual. All right. Thanks for joining us today, and thanks for giving the lecture to public as well as medical team. All right. So thanks, doctor.
Thank you. My pleasure.